I'm a physician, meaning I do practice medicine every single day. The way we practice medicine historically and nowadays is what we call reactive. We react or respond to certain changes our human bodies go through. Changes caused by infections, inflammations, injuries, or aging-related changes. As a cardiologist, sometimes I act like a plumber, dealing with clogged pipes to try to reopen them, or I feel like an electrician dealing with arrhythmias, irregularities of the heart using electric devices. But by doing so, we try to prevent further damage, but we really do not repair any damage which has occurred already in our bodies. On the other hand, stem cells, or stem cell therapy in particular, is a new way of thinking nowadays to change the paradigm from reactive medicine to reparative or regenerative medicine. And you all have heard about stem cell therapy. You heard about some celebrities from Hollywood going to remote islands to have some intravenous stem cell injections for so-called anti-aging purposes. Or we have heard about football players having their knees injected in Europe. And all of them show amazing results. If you do an internet search on stem cell therapy, within 0.54 seconds, you get 450 million hits. That's more hits than the Pope gets. And if you look at those hits on the web, the vast majority are actually from companies who try to sell you stem cell therapy, advertisings, rather than really scientific data. So within the next few minutes, I would like to tell you a little bit about stem cell therapy, what we know today, how it all started. And by doing so, I want to guide you first to what we do in medicine right now. And I will show you some of our own early experimental studies using stem cells, followed by a few anecdotal case reports in human patients. And then at the end, I want to give you a take-home message, what all of you should know about stem cell therapy, which is probably one of the most promising advantages and advances in modern medicine today. I'm a soccer player. I'm on the outside, on the left hand. This picture was sent to me just recently by someone from Germany, dated, I think, 1978. And in Germany, playing soccer is like a religion, like in many other countries, as you know. And we all remember the famous quote of the German soccer coach, Sepp Herberger, "Der Ball ist rund," which means the ball is round. It sounds simple, but has actually significant philosophical meanings. I took another picture, that's a year ago. I'm still playing soccer, more or less. And by looking at those pictures side by side, I noticed, well, I look a little different, right? I mean, there's some change, obviously, with age. There's 40 years in between those pictures, almost. And I remember the famous quote of Heraclit of Ephesus saying, nothing is permanent except change. So, and medicine nowadays deals with those changes. Patients come to the doctor's office or the hospitals because they have symptoms, for example, chest pain, or they have injuries, as an example, a broken leg, or they have chronic degenerative changes, arthritis in the knees, or an inflammation in the skin, or loss of function or loss of tissue. All these are changes we deal with in medicine. And traditionally, many of our organs, such as the heart and the brain, are considered differentiated organs. That means the cells we have in our heart today are the same cells we were born with. So once there is some damage, we can't repair them, even though we do have some stem cell potential in our bodies. We lost the power to repair a large amount of damage. So as a cardiologist, we put plasters and bandages on damage rather than repairing it. I just wanted to show you briefly a case of a young man I saw a few days ago, a 49-year-old man. He came with new onset of chest pain and was diagnosed with a heart attack. So we took him to the cardiac catheterization laboratory, where we take a catheter from the groin or from the arm into the heart, inject contrast dye into the arteries, which is shown here. And in that particular case, the right coronary artery was completely blocked, meaning there's lack of oxygen in large portions of the heart, which can lead to death. So as I mentioned, like a plumber, we go ahead with drills and wires and balloons and metal rings, which we call stents, open up that tube, and the blood flow is established and heart attack is treated. There's other ways, of course, to treat heart damage. If it's more severe, we might have to do open heart surgery, as shown here, sometimes even on the beating heart, where we use what we call bypass grafts to overcome blocked arteries. We use those grafts from the legs or from the chest of the same patient and basically bypass the blockages in order to treat the coronary artery disease. Or, in more extreme cases, we take the whole organ out. We do what we call a cardiac transplantation. But this is a major surgery, of course, and this is more regeneration than repair. But there's only 2,200 heart transplants done per year in the United States, but there's more than 6 million patients suffering from heart failure. So what leads to those damages and diseases? In a large part, it's aging. And we all age differently, as you know. And of interest, there are certain species who don't age or even immortal. Some fungi, for example, are immortal. And this picture shows a shark, a Greenland shark, who is supposed to be 512 years old. So how come that a shark can live hundreds of years while our lifespan as humans is usually less than 80 years of age? So obviously, he eats a lot of fish and swims a lot. That might help. But of interest, sharks have an unlimited regeneration of their teeth because of an abundance of stem cells in their body. So if they lose teeth, they can replace them. And that might play a role in the long age. So what are stem cells? Stem cells are unique cells which have the ability to develop into any cell in our body, whether it's a brain cell, a fat cell, a skin cell, a bone cell, a heart cell, whatsoever. And in the embryonic stage and in utero, stem cells are responsible for the development of our organs. We have to learn from nature. If you cut off the limb of a reptile, of a salamander, for example, due to an abundance of stem cells in their system, this reptile is able to completely regrow that limb, so they don't lose it. And we as humans, by the way, have the same ability, but only during the first 4 months in utero. After that, the limb is cut off, we lose it. So let me tell you briefly how we started stem cell therapy, and we were among the first in the world using embryonic cells in experimental animals, where we took the hearts of pregnant animals out, took the stem cells from the heart and injected those in recipient animals in which we created heart attacks before, into the border zone, as shown here, of scar tissue, damaged tissue. And by use of staining techniques and fluorescence microscopy, we could demonstrate for the first time that those cells from other animals basically could survive within the recipient for up to 6 months. And moreover, that led to an improvement of the contractile function, meaning the strength of the heart in those animals. From the experimental view, let me just tell you a few case reports. This lady on the right is an 87-year-old lady, a patient of mine who came to us a couple of years ago with severe, what we call coronary artery disease, blockages in the arteries, not amenable for any interventional or surgical therapy. In fact, this lady was so symptomatic that she could not even leave her house to go to the mailbox to get her mail because she had chest pain and was short of breath. So the only option was an experimental approach, intravenous stem cell injection. So after 3 months, she was basically completely asymptomatic. After 6 months, she traveled the world on her own, flew back to Japan, was walking through the mall, no symptoms whatsoever. That's 6 years ago, still doing extremely well. That's a single case, but let me tell you about another case. This is a young man, 32 years of age, who was admitted to a large academic hospital in Los Angeles with a very rare condition which we call calciphylaxis, which means that he hardened all his arteries through the entire body. The kidneys failed, was on dialysis. He had several heart attacks, his colon ruptured 3 times, and the entire integument, meaning the skin of the body, fall off. In fact, this condition has a mortality of more than 90%, meaning 90 or more % of people who have it, they die within a month. So I was asked to put this patient on hospice, but we refused to do so. He's 32 years old. So we treated him several times with stem cells, and of interest, after 14 months being in the hospital, he left. He did lose both of his legs. He still is on dialysis, but he is alive. Way to surprise to all the doctors involved in this case. Nobody had expected that, because the stem cells helped basically to rebuild and repair some of the damage in his organs. So how do stem cells work now? So there's different hypotheses, but let me just show you the main modes of action, if you wish. The first mode of action is anti-inflammatory. They fight inflammation. So if we have a heart attack, for example, this is always affiliated with a local inflammation in the organ. And this slide on the lower portion shows you injections 3 times of stem cells, and then we measured the tissue content in the heart muscle of inflammatory parameters, which showed a significant reaction with regard to reduction of the inflammation after every single injection. In addition, on the upper portion of this graph, it shows the left ventricular function, the strength of the heart, compared to in red a placebo-treated group, and which showed the same thing, that the injection of stem cell improved the strength of the heart versus placebo or standard therapy did not. In addition, there's what we call angiogenesis, the build-up of new blood vessels. This is a picture of an experimental animal where the femoral artery is completely occluded, and we injected stem cells into the tissue, and here you can see hundreds of new blood vessels, capillaries and arterioles, which try to save the limb by providing oxygen to the extremity. This is what we call angiogenesis or arteriogenesis induced by stem cell therapy, and it works. Thirdly, there's regeneration or paracrine effects, and in particular in the heart, several studies have shown that there's some degree of regeneration. If we inject stem cells directly in the heart, those stem cells are able to conform and to develop into contracting heart muscle cells, who are then able to contract in synchrony with the recipient cells. Other people don't believe that there's a complete regeneration, only a partial, but there might be paracrine effect, meaning the stem cells might be able to strengthen the surrounding healthy tissue, which also in turn then leads to an improvement of the function. But there's always bad news about everything. And if you look in the news, there's a lot of announcement, for example, from the FDA, the Federal Drug Administration, stating that stem cell therapy is not FDA approved. We do it in the frame of clinical studies, but it's not an approved treatment, and the FDA warns against undifferentiated use of stem cells. On the other hand, 2 years ago, there were several news reports about 18 patients all over the country in the US who ended up in emergency rooms with blood infection, sepsis, as a result of one single intravenous stem cell injection from one particular lab. And as a consequence of that, the FDA shut down that lab and shut down several providers' offices who obviously did not conform to FDA and other industry regulations and didn't use cleanliness to ensure non-contamination of their products. So be cautious about that. On a positive side, we see positive reports in the news. This is a young man at the University of Southern California, was completely paralyzed after an accident, and after stem cell injections into the spine connected to the brain, those cells were able to regenerate in part neurons, nerve cells, and now he can move his arms, which he couldn't before, and even can lift some weights. as you can see here. So let me just summarize about the myth. The myth is stem cell therapy FDA approved? No, it's not at this point. Do stem cells cure certain diseases? No. Don't believe it. Some people make false claims about that, with the exception of stem cell transplantation in certain forms of cancer, but this is a different story. Some people might tell you stem cells have no side effects. No, that's not true either. We not even know the long-term effects. There's some data that cancer cells might be promoted even with stem cell injection, and there might be some immune responses. So there's a lot of unknowns at this point. Stem cell injections can be performed by anyone? Definitely not. I recently had actually a technician coming to my office trying to sell me stem cells from his company. At the same time, I had a patient in the next room. Behind my back, the technician went to the patient, went to his house. The next day, injected him in the knee with his product. Unethical, unprofessional, unlawful. Not everybody should do that. All labs provide high-quality products. No, this is wishful thinking, but in our experience, we have seen a lot of non-conformity to regulations. Facts are that stem cell therapy nowadays is the most promising advance in modern medicine. Stem cells have a responsibility to repair damage and heal. They decline in quality and quantity in our body. The older we get, the less potent stem cells we have. They do induce a natural healing, but sometimes need to be mediated from the outside. But again, nothing is permanent except change. So at the end, let me just briefly mention COVID, since we're in the current pandemic. This is a Chinese doctor who injected 9 patients with severe COVID infections in China, Wuhan, with one single intravenous injection of stem cell. They all recovered. This is non-randomized controlled, but I can tell you, we did our own study, randomized, placebo-controlled, double-blind, with amazing results soon to be published. So if you consider as a potential consumer in patient stem cell therapy, ask questions. Ask the provider about their own experience, their publications. Where do they get the cells from? Which labs? What is their reputation? But keep in mind, we are in the process of changing from reactive to regenerative medicine for acute injuries, but also for chronic degenerative diseases. And this is the future of medicine. Thank you.